subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Kalpana Sarangi. Dr. Kalpana Sarangi is head of the dermatology department at the Nanavati Max Hospital in Mumbai. She's a qualified MD in skin, and she started off as a dermatologist and subsequently established herself as the head of the Cosmetology Centre at the Nanavati Max Hospital. She has nearly 3 decades of experience and is one of the few qualified, and I would say pioneering skin specialists in the country to have established herself as a cosmetic dermatologist. She has to her credit more than 100 published articles in Indian and international journals, and also co-authored the textbook and atlas of Dermato-surgery and cosmetology, manual of Dermatology Surgery, and she's a recipient of 2 gold medals at the national level, and exceedingly sought after, I would say. Dr. Sarangi, you have a waiting of several weeks, several months.
No. That's not true.
Welcome to Health Live at Seniors Today. We
Thank
are
you so
privileged to
much.
have you here with us. And how's it been? How's this is the festival season, so is it also a festival for skincare where people need to take care of-
Yeah. There is a mad rush to look good for the Navratri, then Diwali. So post Ganesh Chaturthi, we get busy till the end of the year. Busier than the rest of the days.
And would you say that, since you've worked for 3 decades, would you say that the craze for better skin has kind of grown over the last 15 years?
Yeah, it has. In fact, I would say since the last 2 decades, skincare awareness has it has multiplied many folds, and people have become aware, both men, women, young, old, everybody. Awareness is really tremendous, and I would say that it is more because of the social media and the awareness which is being published everywhere, whether it's television or print media. So people are becoming very aware, which is a good thing.
That's right. And in the COVID period, obviously there were some excesses that happened related to with the skin as well because of COVID. Is that something that you felt?
Yeah, COVID, we had a very strange sort of response in the like when most people, they didn't want to get their face treated because they were having the face was covered, right? So like we had a slump area, a period because of that for a few months. But one thing which all of us noticed across the world, there was a lot of hair fall. Everybody had hair fall who had a COVID infection. They subsequently after a month or 45 days, they started tremendous hair fall. So we had a movement, in fact, to assure people that it will come back and all that. Plus, there were certain specific skin issues which we saw in COVID, which was like, infection of the lower part of the legs, and then some and especially people those who are wearing using a lot of sanitizer for the hands. They had housewives dermatitis, and then allergic contact dermatitis, things like that. But in general, the care of skin, like to look beautiful, the zeal had lessened during that phase, because people used to say that our faces are covered in masks. Why should we spend money on it?
So, doctor, what is since you mentioned about sanitizers, what is the care to be taken about sanitizers? Because there are sanitizers. I know at my home, in fact, just here, I have a bottle of a sanitizer which is kept here. I don't think I have used it for the last 3 months. So how long should one keep it? How should we be careful about sanitizers?
Yeah, see, the thing is, you have to be careful about sanitizing your hands. But after over the last 2 years, I've realized that, you either use a non-alcohol, like a aloe vera based or moisture based sanitizer, either use that, or best is to wash your hand with soap and water, or just plain water. Just wash your hand with running water, under running water, and avoid touching your hand to your face, because that is how we transmit the virus. Though now the latest technique, latest theory is that you get infection only through airborne. So sanitization of the surfaces, like we used to sanitize everything, including the vegetables, our tables, our chairs, the house. Like people have spent so much of money sanitizing. And so now it's just the mask and social distancing.
And what about masks? Could there, there were people who have said that they've had some skin issues because of
You're
wearing
right.
masks.
You're right. In fact, like I have presented a paper also, the mask induced dermatitis, like in the COVID era. Because of the mask, like a lot of people have developed pigmentation, and especially people like for us, doctors, we used to wear masks for 9 and 10, 12, sometimes 12 hours together. So we have developed certain pigmentation on the face, and people those who wear the mask and work, especially people those who are facing the kitchen, or people those who are working outdoors who are exposed to heat, they develop a lot of acne also. So acne, allergic contact dermatitis, and retention cyst dermatitis, and pigmentation was something which was in because induced by the masks. So that was one thing which was also.
Right. Thank you, doctor, for being here. I'm going to request our producer Dimple to share the screen, and so we would love to have you talk about skincare for seniors today. And yes, so the screen is being shared.
So what I plan today to talk about is, I'll talk on general skincare and what are the things which we face in a day-to-day practice and what are the type of treatments available. I'll just quickly go through some of the things which is available these days to keep yourself beautiful. This is for both for men and women. And then later we can take questions pertaining to.
Those of you who have questions, please put them in the Q&A tab. And as always, what we request you is put in your age and your gender for the person, the gender and the age of the person for whom you are asking the question, so that Dr. Sarangi would be able to give a better reply. Over to you, doctor.
Yeah. So let us talk about how to keep our skin beautiful. Can I see the full screen? I can't see the full screen.
Yeah, it is actually the full screen right now. The first screen is saying skin and its importance.
Yeah. Okay. So, like all of us should have a good, healthy, natural skin, which is, of course, should look natural. And because a good skin is a reflection of our inner health. So that is what all of us, irrespective of age, I always tell people that try and look as healthy as you can and reflect your health through your skin. Can we go to the next slide? What I'll do is, I think I will take my, So all of us would love to have the skin which we had when we were babies, right? So, but then we don't do enough to maintain that kind of skin. So how do we do that? Skill wellness and its care. We should know about our skin, what our skin needs, be aware of the type of skin we have, seek expert advice in choosing the type of soaps and cosmetics we use, because sometimes what we do, we inadvertently use a lot of products which is not required for our skin or which is detrimental to our skin. So that way we have to be careful of what are the products we're using. So that is where you need to take expert advice so that you you avoid premature aging. That is something which we can do, which is within our reach. So I'll handle my slides, and I'm reading it from a different screen. So if life is, can we go to the next slide, please? Yeah. No, the previous one, the one after this. Yeah. If this is my favorite slide, it says that if life is about change, this is the classic example. Like this is how we age. Next. Yeah. So what is the frequently asked question is, when does the skin start to age? How does aging takes place? And what are the visible signs of aging? These are the three most important questions which is asked to me. So when does the skin start to age? Aging starts around the age of 25. So that is the biological thing, what happens to us. And how does the aging takes place? It, suddenly you'll find that, skin is becoming dry, you'll getting like little spots on your face. Before the wrinkles or the lines appear, all these things will start. And then, your natural oil will be reduced. So these are the certain visible signs of aging. Next. So aging is a natural part of getting older. And from the moment you're born, our skin begins to respond to two sets of biological processes. Next. That is intrinsic and extrinsic. Intrinsic is natural, which is genetic. And there is decrease of collagen during menopause, contributing to collagen loss in women. And exchanging is sun damage, which is causes 80% of aging, smoking, stress, poor nutrition, and pollution. These are the things which aids in faster aging of our skin. Next. There are many of the external causes of aging of skin are determined by the health and lifestyle. I would like to stress on the lifestyle decision which we make, because having a holistic approach to the skin makes you helps to preserve your skin for a longer time and prevent all the problems which you face when we age. And making unhealthy choices can cause prematurely aging skin that makes you look older faster. Next. So what are this aging? With aging, what happened? There is overproduction of free radicals, also with age, and also mental stress, environmental pollution, sunlight, chemotherapy and radiation, nutritional habits, alcohol and smoking. So these are the factors which produces free radicals, which helps in, or rather which causes aging. Next. The sun is the biggest problem which we have in a country like ours. So we must protect ourselves from the sun. I would say that sun is not the only the cause of our the causes to skin, but the causes of UV radiation. UV radiation could be because of the sun. It could be because of facing the computer for a long time. It could be sitting in a room with lights on, or it could be using a lot of your the mobile or cooking. All these things lead to aging of the skin. Next. So this is how our skin ages. Like, this is how the damage causes to our skin. This is a healthy skin and this is a damaged skin. As you can see, with age and the damages, this is how the skin becomes rough, dry, and pigmented. Next. So these are the physical signs of aging, which we see in our skin. That is dryness, dull, uneven skin, darkening of skin, loss of firmness, rough textures, sunspots, appearances of fine lines and wrinkles. These are the same things which you normally have, which we don't like. These are not disease skins, but these are normal process of aging. These are the things which you see. So these are some of the pictures where you can see lines, and then there is pigmentation, and there is loss of turgidness of the skin, sagging of the skin. Next. So what is the treatment we should do? We should protect ourselves from the sun, but again, we should expose ourselves to the sun between 8 to 10 so that we get enough vitamin D. And after that, please make sure that you don't go out in the sun between 12 to 4 o'clock. So that is the damaging rays of the sun available during that time. So try and avoid the time. And if you have to go, then please carry an umbrella, wear a cap or a hat, and use a proper sunscreen. Next. Photoprotection is a must for people, those who are having very sensitive skins. And you should use a sunscreen which has both UV and UVB. Next. And like physical photoprotection, like I told you, wearing full sleeve clothes, umbrella, and caps are a must for people, those who have sensitive skin. And use a sunscreen which has 4+ rating, and SPF should be 30 or 50 if you're an outdoor person. Next. Okay, now what are the type of, these are the products which you should use on the skin, the facial skin and the skin which is exposed to the sun, especially the hands and the neck, along with your face. You use a gentle cleanser and a toner moisturizer, and use skin-friendly vitamins, which is additive in today's moisturizers. And use a demelanizing agent if you're getting age spots, under eye creams if there's puffiness, and anti-aging products. Next. But I would like to tell you, aging is a biological chronological process. We cannot stop aging, but we can delay aging. Now, some of the skin rejuvenation procedures like chemical peels, botulinum toxin, dermal fillers, and laser therapy. These are some of the things which I wanted to tell you, share with you. I just wanted it to be a fun type of presentation, not a very serious medical type of thing. But after the presentation, I can answer all your questions pertaining to any specific issues which you are facing. So I'd like to tell you what we do to preserve our skin and to keep looking young for a longer time. Next. So chemical peels are very simple treatments, which is done within 10 minutes. It's a OPD basis treatment, and the most cheapest type of treatment available, or rather I'd say most cost-effective treatment in our armamentarium. Next. So it rejuvenates, remodels, it removes the tan. It also takes care of the initial signs of aging of the skin. And next. So we have several types of peels, superficial peels, deep peels, and medium depth peels, depending on the type of problem you have. We choose a peel for you and you can take it. And like a lot of people do it, even you can do it for your hands also, the dorsum, the hand which is exposed to the sun. Next. So what is the outcome of peel? What do you expect? So your skin becomes youthful, it looks smooth, and then there is reduction in the some of the fine wrinkles also. Next. We treat acne like, some of the senile comedones, senile acne, some people at an age, even after 60 also, they sometimes see comedones, that is pimples. So the peels can treat senile comedones, it can treat photoaging along with pigmentation. Next. Next. So now the question comes, who can benefit from a peel? In fact, everybody needs a peel. In fact, our great monument, the Taj Mahal, also needs a peel to look good. So virtually everybody can do with a peel, starting from the age of 15 for acne to the age of 70, 75. Next. Now coming to something known as botulinum toxin, which is it's a simple cosmetic process, but it is an injectable which is given to erase your wrinkles. It is a temporary treatment. Of course, every 6 months you have to do it. Next. So it is a purified protein which is derived from botulinum, the Clostridium, and it gives rise to erasing of the wrinkles. Moderate to severe type of lines or furrows can be erased, and you can do it for any age between 25 to 65. Next. So this is how your wrinkles can get erased. This is some before and after pictures. So those wrinkles look smooth. Next. Now coming to something known as dermal fillers. If you know that we have something known as hyaluronic acid in our skin, with age and with sun exposure, with external pollution, it gets depleted and we get that furrows and lines which are permanent. So these dermal fillers, it augments the skin. We give it from outside and it improves, it irons out your wrinkles. So what does a dermal filler do? When this is with age, what happens? We develop these sort of lines. So when we put the injection under your skin, then it fills up the furrows and it smoothens the surface of the skin. Next. So the dermal fillers can be given anywhere. It is an injectable again, and the result lasts for almost a year. And it can be given anywhere in all the points which is shown over here to fill it up, to make your skin look smooth and firm and full. So like I told you, the aim of dermal filler is to volumize your face, to give contour and to sculpt your skin you can look almost 10 to 15 years younger on the table. So these are the points where we age, and these are the points where we enhance with our treatments. You can treat the forehead, you can treat the frown line, under eyes, the cheek augmentation, the upper lip, the lower lip, the lips, the jowls. These are the points which we treat. Okay, so I'll not go into details. I've already told you about this, how to enhance the features of your face. Next. Okay, now coming to this, another treatment which is known as laser, which is a beam of light of radiation which can be used to deliver intense intensity to specific areas of the skin. So laser is a very versatile tool which we use these days, and it is used to not only remove hair, which is very common, but it can be used to remove certain conditions like, like you can take care of your wrinkles, fine lines, you can take care of any pigmentary disorders, you can take care of any tattoo removal also can be done with laser. And there's certain seborrheic keratosis, actinic keratosis, which is seen in elderly people that can be treated by laser without leaving any. With laser, what it does is it treats the area and also it seals the bleeding. So I've seen with senile comedones and seborrheic dermatitis, seborrheic keratosis, which is seen in elderly people, especially men who don't have much hair and they have a lot of this black spots on their forehead or on their scalp. This can be removed by laser. Next. So there are two types of laser. One is ablative and one is non-ablative. Ablative one which destroys the superficial layer of the skin. So there'll be a bone for a few days. And non-ablative ones are which doesn't destroy the skin, the surface of the skin. So those are the ones which are used for aesthetic purpose, but the ablative ones are used for medical purpose. So these are some of the the treatment modalities available in our day-to-day practice to combat aging in an aesthetic sense. But we have a lot of this dermatological condition also, which we treat, like dryness of the skin, hair fall, and hand contact dermatitis, and sun photo damaged skin. So, or itching or fungal infection, all these things also we see, and we treat them at our Nanavati hospital. So if you have any question pertaining to skin problems of any type, we can address it here. So can we go to the next slide? So laser, like I told you, laser treatment can treat acne. Like acne can be senile comedones also, persistent melasma, wrinkles, facial rejuvenation, skin tightening, stretch marks, unwanted facial hair. Next. So the aim is to give you skin beautiful both from inside out, and the inside story you have to write, and the outside story we are there to write for you. And you're most welcome to come and take help from us from any time. We are there in Nanavati from Monday to Saturday, every day. And if you have any questions, I'll be very happy to answer. And if you have any doubts, please feel free to ask me questions.
Thank you very much, Doctor. This is, a very enlightening presentation. I want to ask you this question. Is this, there are a lot of skin treatments that you spoke about. You showed wrinkles, various actors, well-known celebrities have got it done. But is there an age for all of that, or can one do it till whatever time?
Yeah, it depends. Like, people have, like, I had a person who walked into my Nanavati hospital. He was 86 and he had never done any treatment. He asked me, Doc, is it too late to come for any treatment? I was so happy. I said, no, age is not a limit. It is what you want to look like. It's your wish, what you want to do. So the age is not a limit, but of course, there are certain treatments which after certain age, it will not have the similar result which you would have in a younger age. But there are limitations. So we explain it to them. But any treatment can be done. Like ideally, it should be for the age of 70, 65, 70, because Indians, we have a very good skin. It's not like the foreign skin, which ages very fast. In India, our skins are very good. We preserve our skin very well because of the natural melanin, which is there. Melanin is the black pigment, which it protects the skin from photo damage, from faster aging. So we can do from the age of 25 to the age of 75, we can do any treatment.
Right, Doctor. And, I want to ask you various questions about your star patients, but I think this is not the right forum to do that. But we have quite a few questions that have come in. One question, and I think it's a very unfair question to ask you on the forum like this, but still, is Botox and all these things, are they very expensive?
It is inexpensive. Botox is not very expensive. In fact, Botox it can be done like depending on what are your indications. Like if you just want to get rid of your frown, it will be around 4,000 or so. And then if you want to do the full face, it will be around 10 to 15,000, which will last for almost 6 months. But fillers are, it is expensive. Fillers.
So every 6 months, I'll frown less, and then, after 6 months, I'll start frowning, is it? It's joking. Doctor, there is a question from Yasmin Todiwala, who is 72. And she says, I have white spots on my hands with different sizes. How do I stop them?
Yeah. White spots could be because of, it is something known as idiopathic gutted hypomelanosis, if I'm guessing it is right. So sometimes it is aging and sometimes it is because of certain deficiency. Depends on what kind of patches she has. So I mean, she can come and show it to us and it can be treated. Right. If it's not growing fast, it can be treated.
And there is a question about cure for white patches on the face and skin near the hairline. Is it the same?
Yeah, it could be same. the problem with skin is, it can be vitiligo, it can be depigmentation. They're two different things. Vitiligo is something where there is no pigment at all. And depigmentation is something where there is cessation of pigmentation because of some insult, like sometimes because of dye, or sometimes you wear this rainy shoes. And because of the benzene in that in the plastic, you would develop loss of pigmentation. So in that case, it can be reversed 100%. But if it is vitiligo, it can be treated, but it takes a longer time. So there are different causes of loss of pigmentation. So white patches.
Right. Thank you. We have a question from a 76-year-old lady who says her face, especially lower half, jaw area is sagging. Can anything be done? She's 76. And she says,
Yeah.
your skin looks very good. How much would laser cost for rejuvenation, or is it too late?
No, it depends how much of sagging she has. We can do something known as, there's something known as thread. Thread is also something which I didn't add in this because I didn't want to scare everybody off. So for the lower jaw sagging, threads have a very good role. So recently I just treated a 75-year-old lady and she had a fantastic result. So we can work on her, not an issue.
Right. Doctor, the question that has come in by SMS, that can any of these skin treatments also have a negative effect, like Botox or whatever else?
See, Botox, definitely every treatment has its side effects, but if it is done properly with an expert hand, the side effects are much less. But yeah, if Botox is injected in the wrong muscle, then you'll have a different effect. Instead of your brow being lifted, it can come down. It is known as browtosis. And suppose there is filtration of the Botox into certain other areas. If it is done by untrained people, then it can cause the dropping of the lips. But whatever it is in Botox, it is temporary. It lasts for a month or so, and then it will come back to normal. And with fillers, what happens? You might develop some infection if you not done properly. And suppose you can develop some it can, if it is not given properly. Like sometimes what you do when you inject, we draw the syringe, meaning we see whether it is into a vessel. Suppose injecting into a vessel, then there can be a disaster. There will be ulcer or the certain trauma to the skin because you're stopping the blood vessel at that time. So it has to be done in a very scientific way.
Right. We have Mr. Bharat Badheka, who's 70. He says, I'm suffering from itching problem on body and more on legs. It has increased after knee replacement. The skin doctor has advised to use Venusia cream regularly more in many parts of the year. Sometimes it's mixed with Nemote cream. I'm on medication of high blood pressure and mild diabetic. I don't use soap. Please suggest a medication.
So he can use soap. So he can use a moisture-based soap like a Venusia soap or Dove or Nivea, or Pears. He can use a soap. And I would suggest let him use coconut oil, any oil, body oil before bath. That really gives a nice film of oil throughout. And then there are body baths which are contains shower oils. They're called shower oils. Sebamed, in fact, has a shower oil. There are 2-3 other companies, they have a shower oil. So if you use that for your body wash, then you have a good thin film of oil on your skin surface, and it protects you. And secondly, when you say it's a good cream, you can continue that any other body moisturizer like Aqua Soft or anything like that. But restrict your use of Moment, because Moment is a steroid, but for some time you can use. Dilute it with your Venusia. If you're taking one part of Moment, mix it with 6 parts of Venusia and apply. And do it for 2 weeks, then stop, and then use only Venusia.
Right. Doctor, we have an anonymous attendee who's 60, and she's a lady who says, I've got a lot of moles and few warts on my skin, especially on the neck, arms, and legs. What can I do to prevent these?
See, what she's talking about is skin tags, I think. They can be removed. It's a one-time this thing. But prevention is like, there are 3-4 causes of these skin tags. One is diabetes, one is age, one is exposure to the sun, one is hereditary, and obesity also. So if these are the causes of skin tags, so she has to take care which category she falls in. And if she's exposed to the sun, she can protect herself by using a sunscreen. And if this is hereditary, then she'll keep on getting it. But the best way is to remove it once and then see how it comes back. And after 2-3 years, it comes back, then you need to remove it again. So it's a very minor thing. We do it by radio cautery, so it's nothing major. It can be removed.
Thank you. We have a question from Mr. Malcolm Montero, who's 69. Over the past 2 years, I have developed on my face, neck, shaving area, warts, HPV. I was advised to use salictin paint on the warts. I've seen a reduction in warts since then. However, there is pigmentation in those areas. His questions are, what is the best way to remove pigmentation? And the second is, the warts still come on, but few and smaller in size. What should I do?
See, for warts, you can use, there's something known as imiquat. So that is a cream which we usually give for warts. It doesn't have any side effects. I mean, alternate nights you can use it on the warts, and it's a very annoying area to have warts because you're shaving it every day. So what you're doing, you're auto-inoculating, meaning you are passing the infection again and again to yourself. That is where it becomes resistant. It doesn't become resistant to treatment. It keeps on reappearing because of auto-inoculation. So the best way is to use imiquat. And you can, for pigmentation, you can use a depigmenting cream. There are a lot of depigmenting cream available in the market which contain arbutin, kojic acid, and retinol. All these things are glycolic acid. These combination creams are available which you can use to get rid of it.
You know, Dr. Sarangi has been using a lot of medical terms and her advisories. So this video will be available on seniorstoday.in on Monday. You can watch it again and note down the exact advice that she's given. Of course, we will also be having, as always, a medical practitioner who writes the takeaways on this. So that will also be there on Monday evening. So please look at that, because I know, a lot of things have been said by doctor and you may not have noted it now, but you could always watch this recording once again and benefit from that. We have Mr. Shrikant Kulkarni, who has asked, he's 70. And during COVID, we saw many videos advising 20 minutes daily exposure to morning and evening sunlight for increasing immunity. Do you think it is right?
No, there's varied views on it. 20 minutes, if you sit in an Indian sun, will burn your skin. And just sitting in the sun doesn't increase your immunity. You just need to be exposed 5 to 10 minutes of the good sunlight to increase your vitamin D levels. That is it. Morning 8 to 10, or rather it's 7 to 9 is the right time. 5 to 7 minutes is good enough. And evening, if you want, you can go for a walk around 5-ish or so. Not during 10 to 4, you should avoid.
Right. Thank you. We have a few more questions, doctor. Should dry hair be oiled before a head bath, and for how long?
Yeah. Oil is a very good condition. I always tell people that to oil if they don't, I mean, obviously above 60, you don't have a chance of pimples, but you can oil the hair before the night before you shampoo. And that will be like, when you oil, first of all, it improves the circulation of the blood on the scalp. And secondly, it acts as a natural moisture conditioner. So it's good for you.
Doctor, we have a few.
And twice or thrice a week, you should wash your hair.
And twice or thrice a week, oil your hair as well.
Yes.
We have a few questions from which oil would you recommend? Could you suggest a good moisturizer for the face? I know we don't want to recommend too many brands, but please go ahead since you've been asked.
I can tell that coconut oil is good.
What is the brand that you use, doctor?
Brand I can't say.
All right, what do you use? What kind of moisturizer is good to use? What kind of soap should one use?
If you have a dry skin, you can use there are two types of moisturizer. One is oil in water, water in oil. You have to see. So if it is in a jar, it is more of oil. So that is for good skin, which are dry, very dry skin. You can use that. And if it is in a tube form or the spray form, it is more of water. So if you have oily skin, you can go for that. And as a body oil, I mean, as a hair oil, I would recommend coconut oil is very good. And if you can stand the smell of mustard oil, nothing like it. So, and use the sunscreen, which is again, like, depending on the skin type, you can use either a oil-based sunscreen or oil-free sunscreen. We have silicone-based sunscreen these days, which is nice and smooth and very silky, very good effect on the skin. So you can use that.
Right. Doctor, we have an anonymous attendee who's asked a question. He says, my wife, 72, develops cyst-like inflammation around 10 mm with diameter. She gets pus and develops fever. She has to take antibiotics. It gets cured but recurs frequently. Lately, she has taken Taxim for 5 days and does hot fermentation and tea-bagged ointment. My question is, how many days can she take these? Is it sebaceous gland inflammation or uh, folliculitis? Mammograms
If it
and
is a
breast
single,
sonography are normal.
okay. So if it is a single cyst and if it keeps on recurring, sounds more like a sebaceous cyst. So in sebaceous cyst, hot fermentation is not the right thing and he should not squeeze out the content. And if it is folliculitis, then whatever he's taking is fine. He can take the antibiotic for 5 to 7 days. Sebaceous cyst also, if it is infected, he can take antibiotic for 5 to 7 days. And then I would suggest he comes and gets it removed because it will keep on coming up again and again and bothering her. So advisable to remove the cyst.
We have Mr. Pankaj Thakkar, who's 65, and he says, I have a black mark on my left leg due to eczema. How does one remove it?
Is it if it is dry and raised, then we can just treat it with topical medication which contains salicylic acid probably. And it sounds as if it can be treatable. So you can come and visit us.
Right. Doctor, this Shrikant Kulkarni asks again, he is, 70? He says he wants to, are tattoos harmful? He asks, are tattoos harmful?
Tattoos are not harmful. Only thing is if you are stuck with a tattoo which you don't want it later, like you are in love with somebody, you tattoo his name and after 5 years you don't love him anymore, you want to get it removed. I see so many such cases. I mean, both in girls and boys. They want to remove a beautiful tattoo. I asked them, why do you want to remove it? I said, I'm getting married. The person name is something else. So that is the thing when people want to get it removed. But otherwise, tattoo is not harmful.
Right. And doctor, what about Ayurvedic creams? There's somebody who's asked a question about Ayurvedic creams, and
very good question.
Yeah.
See, I'll tell you, like I use a lot of botanicals. Botanicals, like something which is become so internationally famous. And this is definitely inspired by our Indian culture and Indian knowledge people have taken from there. So very high-end products which has botanicals are very good. But unfortunately in India, whatever Ayurvedic preparation we have, they are not standardized. So they give a lot of reaction. I can name them, they just give such bad reaction. But yes, if you're using a plant-based product and from a very good company, then I would always suggest you carry on with it.
What about the homemade, therapies that exist in India?
Yeah.
There's haldi and chandan and all of that one keeps talking about.
You can use it if it is not contaminated. First and foremost, don't take it from the kitchen itself. Don't take a scoop of haldi from the kitchen and use it because it will be contaminated. If you want to use haldi, make a separate powder, keep it in your bathroom or keep it in a different shelf. And if you want to, honey, I suggest a lot of honey to young girls who have a lot of facial hair because it's a natural moisturizer and it's a natural bleach also. So it bleaches the facial hair. And milk and curd contains lactic acid, which causes mild exfoliation. Besan causes exfoliation of the skin, drying of the skin. But it has to be used in a pure form, not like what you get in the market, ready-made ones. Make it at home and use it.
Doctor, we have a question about somebody whose daughter has a keloid. Should one be going to a skin specialist or should one be going to a plastic surgeon for a keloid treatment, which keeps surfacing?
We treat keloids. In fact, we have different type of methods of treating keloids, dermatologists. And I'm sure plastic surgeons also have their methods of treating. But yeah, we use a lot of keloids.
Great.
We treat a lot of keloids.
Doctor, questions are coming in, but we've crossed the time of 5:45. Thank you very much for being here. Thank you very much for for responding to so many questions that have been asked. And I'm sure people will be happy to even consult you, write to you, etc. For various ailments. So it was an excellent presentation, and
thank you so much
once again for your time, and thank you to the Nanavati Max Hospital for having facilitated this. And we will be back once again, that is next Saturday, which is October 8th, with another session of Health Live at Seniors Today. It is something on Alzheimer's disease. We have a doctor from Indraprastha Hospital in Delhi who is going to be there with us. And do sign up again. You can always pre-register for our health webinars. The link is there on the chat window. You can look at that. And once again, as I said, Dr. Kalpana Sarangi's session had a lot of medical references. And I know you may not have been able to record all of that, but as always, all our webinars, the recordings are there on our website. They are there on our YouTube channel. You can go to that. We also have takeaways of all our sessions. So you can also look at that, because obviously there's a lot spoken and we try to compress it into an article form and present it to you. So all of that is there on Seniors Today. That is SeniorsToday/webinar, and you can go there and it will be there on the homepage as well as our social media handles. Thank you very much once again, Dr. Kalpana Sarangi.
Thank you so much. Thank you so much. Okay, bye-bye.
Subscribe now and press the bell icon. Never miss an update.